So what we hear a lot of and what we see a lot of is fear. One of the things that we hear a lot is, well, if you talk to somebody about suicide, you're going to put that idea in their head, and it's just not possible.
Growing up in cultural context where there's expectations of a young man, if this conversation would have been made easier, then probably I wouldn't have taken 17 and a half years to come out and say, hey, I need help.
Suicide is often viewed through a moral or a social lens. It is often not seen as a public health issue. Many people will see the person who has attempted suicide as having moral failings. Is it that they are overwhelmed by some sin or some wrong deed that they did?
There are some structures in place, whether that is peer support groups, youth groups, that can be real vehicles for change. Of course, they need proper investing in, and we need to support them for them to be able to respond and be stronger. But I think that gives me some hope.
Welcome to Mind the Gap, a podcast about what's missing in global mental health.
I'm Christy Savetta.
I'm Chris Underhill.
And we're here to explore the stories, solutions, and systems shaping mental health around the world.
From community champions to global change makers.
Let's dive into what's working and what's not.
And what it'll take to close the gap.
Welcome to another episode of Mind the Gap. I'm Christy Savetta, and I'm here with my co-host, Chris Underhill. And today we are talking about youth suicide. It is a difficult topic and one that we really want to approach with lots of care. But it is, in fact, a subject we can't afford to avoid. More than 720,000 people die by suicide every single year. And it's actually the third leading cause of death among 15 to 29-year-olds. But this conversation goes deeper than numbers. I mean, for me, it's also personal. My stepfather took his own life in 2006. And I know how deeply suicide can affect families and communities and people left trying to get a sense of something that is often surrounded a lot by silence. It's something that cuts across lots of cultures, lots of borders. And so today we want to talk about it not as an individual crisis, but as one of the most difficult gaps in mental health, the gap between distress and help, between warning signs and response, between policy and genuine real support, and between the conversations we need to have and the silence that often surrounds them. And given its cross-cultural nature, we are joined by a really thoughtful group of people today, guests who are bringing perspectives from Kenya, from Iceland and the UK, some with lived experience, others who've spent their lives on the systems, stigma, and policy, and community conditions that shape suicide prevention. And I'm really excited to have them all with us today. I really appreciate you all being here with us. And so before we begin, I'd just love to give each of you an opportunity to introduce yourselves briefly, who you are, where you're joining us from, things like that. And then we can just dive in and get our conversation going. Rosemary, could I start with you?
Thank you, Christy. Rosemary Gathara, Regional Director at Wellbeing. I work alongside young people, communities, and public systems to promote youth well-being so that they can live resilient and thrive.
Amazing. Thanks, Rosemary. Jem, could I come to you next?
Yep. Hi, I'm Jem Barrett, founder and CEO of Naze House, a youth wellbeing and suicide prevention charity based in Bicester, Oxfordshire.
Thanks, Jem, for being here. OJ, over to you. Can you introduce yourself?
My name is Onyango Julian, however, my friends call me OJ. And I am passionate about suicide prevention and mental health well-being among young people. And I work with a network of young people in Kenya. And currently, I am part of the Basic Needs Best Rights Committee.
Amazing. Thanks, OJ. And Erla, over to you.
Hi, everyone. I'm Erla Magnusdottir. I work for CBM Global, where my focus is promoting evidence-based, community-based mental health models. I worked in the global mental health field for 15 years, and this topic is one that sits close to me, both professionally and personally, having been directly affected by youth suicide. Thank you.
Thank you all so much for being here and for being willing, honestly, to have what is not an easy conversation, but a very necessary one. You all are superstars. Chris, over to you.
Thank you so much, Christy, and let me add my welcome to that of yours, to our wonderful team here today. OJ, do you think we could come to you first, please? That would be great. when we talk about suicide at the individual level, what do you wish more people understood about what a young person may be carrying silently, as it were, inside themselves?
I will borrow from my personal experience so that then it can be brought from more easily. The kind of space that particular young person will be in, and how dark that feels, and how isolated and how disconnected to the world that feels, and how a young person will feel like they are different from the others, and they are meeting the end, and there's nothing else they can do, the hopelessness that is in that is. And wishing that there was an easier environment, an easier way to, make it a conversation that can unpack what kind of emotions, what kind of feelings, what kind of psychological complexities that a young person might be going through. And these are things that I have encountered at some point in life when I was a bit younger, a few years back. And of course, with good support, I was able to start the journey to unpack actually what was wrong. And that journey requires a delicate, as Christy said, is a delicate conversation. It's a delicate conversation that does not require judgment, does not require prejudice, that allows people to be human and not to be seen differently, and a space that actually confirms compassion and great understanding. Yeah.
Yeah. Thank you very much, Ojay, for that. And thank you for sharing your personal situation, which obviously I very much appreciate. And it helps us to get an access to the issue, which is very helpful indeed. Jem, maybe come to you. When you and I were talking recently, something you said really stuck with me, which was the difficulty that adults find in actually talking about this subject or raising a question or directly questioning. I wonder whether you could comment on that.
So what we hear a lot of and what we see a lot of is fear, just this fear of having a conversation. So there's a lot of stigma and misinformation sort of around suicide. And one of the things that we hear a lot is, well, if you talk to somebody about suicide, you're going to put that idea in the head, and it's just not possible. We're not that suggestible. So there is a lot of fear, and depending on which kind of grown-ups you're speaking to, with schools, for example, there's a lot of fear based around that, around the safeguarding issues that then may arise out of somebody disclosing their suicidality, not knowing where to go, what to do, who to signpost to, who can step in, how to have that conversation. And actually, that's just what needs to happen, just that open, honest, human conversation, to hear what that young person is saying and to be able to respond appropriately to their feelings of suicidality.
Right. And just as Ojay does his work in the community, as he's been explaining, so you do yours through Nay's House, is that correct?
Yes. Yeah, so we do sort of one-to-one support, we do great group works, social groups, support groups. We run several different 8-week programs that are designed specifically to address particular areas around suicidality and self-harm.
Okay, thank you so much for that. So what we can see, I think, Ojay and Jem, what we can see already is the way in which it's impossible actually just to think of this as a kind of individual thing. It's not just a question of it being affecting an individual. It must also affect the community, and the community, of course, could mean family and the wider community beyond that. I wonder, Christy, whether you'd like to pick that up and take that forward with our guests.
Sure. So one of the big components and pieces around suicide is stigma, which we briefly touched on. So we want to unpack that a little bit more and dig into stigma and how it operates on kind of different levels, from self, community, structural, things like that. OJ, could you come in and unpack that for us a little bit?
stigma for me is the biggest elephant in the room. And I want to borrow back to what I've gone through as a person. If this conversation would have been made easier, if I didn't feel like I was different, then probably I wouldn't have taken 17 and a half years to come out and say, hey, I need help. Probably I wouldn't have come close to completing suicide 3 times. And for me, it's growing up in a cultural context where there's expectations of a young man, and there's this that defines young men. And there are this that if you say as a young man, then you are not fit within the peers that you grow up with. You're not considered a celebrated son, not considered a celebrated brother. And that goes to say that it is not just how I felt, but that also reflected on how the people that I was growing up felt about it, and how difficult it made it to discuss about issues I was going through. And bringing in to do a small comparison with now a time that I experienced stigma at a workplace, that would be structural stigma. There's a time I would numb with alcohol to fit. If I did not drink alcohol, then I did not feel like I fit within the group. I would not feel like I'm socially connected with people. But in actual sense, there were pains that I was trying to run away and address, trauma that I was trying to run away from. And one of those fine days as we were around working with a group of young people that I was training in a training center in Kibea, and one of my colleagues, also a young person, came with a write-up of signs and symptoms of a diagnosis that later got. I don't know how accurate he was, but that is not the point. The point here is how was that discussed? And because that then led to me handing over the resignation letter, I thought that I would do other things, but in real sense, the point was I felt that that group was not habitable for me anymore. So I felt like, now this is not what. But again, it was just at the beginning of now my mental health issues going down to a drain. And that showcases how ignorant sometimes people are about what could actually be called stigma, how we talk about it, the language we use in terms of addressing mental health issues, especially in our context, which of course is embedded greatly into cultural practices, what define a man or a young man in Africa and stuff like that. So this is not just to me. There are so many other people, and I also still have brothers who are struggling with alcoholism. And part of it is to look at why are they not coming out to address some of the issues that I know is obvious with the family versus the help that is, out there that are also got.
Absolutely. Thank you for sharing that OJ. And there's definitely a lot of those components in terms of kind of unpacking what it looks like from a cultural context, what people, I'm going to put some quotes in the air, should be, what they should look like, how they should handle certain scenarios, and then the stigma associated when things aren't going that direction. And Rosemary, from your experience in your work, I'd love it if you comment a bit on where you've seen kind of some of these community beliefs and cultural perceptions of mental health or suicide kind of affect how and when young people and families potentially seek help.
OJ has mentioned in many communities across Kenya, suicide is often viewed through a moral or a social lens. So a person, it is often not seen as a public health issue. It is. So many people will see the person who has attempted suicide as having moral failings. Is it that are they overwhelmed by some sin or some wrong deed that they did, or do they just have they lack faith? Or in some cases, it could be seen as a character flaws. The person is weak, as OJ has mentioned, or the person is not resilient, or they're ungrateful for the things happening in their life. So people will be given an example, so and so has a much worse life than you. Why are you doing this? So in such settings, then it becomes it becomes really hard for a young person to speak out, or for them to openly seek help, and usually the response is not compassionate should they have attempted suicide. But there's also the converse where I have seen in our work that when people in the community, we have teachers, community health workers, even families, where they are empowered or equipped to respond without judgment, where they have, they know to take distress seriously and to help connect the affected person to help. We've seen that community can also be a primary source of protection, a primary source of care, and of connecting people with the help that they need.
That's fantastic to hear, a little bit more about what really changes when communities learn to talk about suicide and mental health with that open lens, and that there is change possible. Erla, I wonder if you can come in with some of your experiences as well, thinking about some of your other contexts that you've worked in. Can you comment a little bit on some of this taboo, this stigma, and potentially what you've seen or what you've seen also work well in combating that?
Sure, thank you. So we at CBM, we work across a lot of different countries, contexts. And one thing I could say is that everywhere that I have worked or even lived, ranging from my home country of Iceland to China, where I lived and worked for a long time, everywhere suicide, there is taboo around suicide. And, we've just heard a little bit from both Rosemary and OJ about sort of contextual things around suicide in Kenya. And of course, there are cultural differences, contextual things that, we shouldn't minimize, that are very important, but equally as well, there's a lot of similarities. And I think everywhere, as we heard Jem say earlier, what I see consistently are these things around struggling to have conversations, taboos, fear. These, I think, are very common across different settings, but also kind of echoing what Rosemary said, communities are not helpless. And I think that gives me hope. There are lots of often some structures in place, whether that is peer support groups, youth groups, that can be real vehicles for change. Of course, they need proper investing in, and we need to support them for them to be, able to respond and be stronger. But I think that, gives me some hope.
Oh, that's really great to hear. And I think that's a fantastic way to think a little bit about kind of what's coming next as well. I mean, stigma, as we've talked about, it doesn't just live within communities. It also it changes how things are done, even from a legal standpoint. It's wonderful to hear and see that when we address some of those components, we can make changes in terms of how a community reacts from a mental health perspective and to suicide. I'd be curious to talk a bit about how stigma and the law relate together, because I think that's a really interesting part of suicide that doesn't necessarily touch on many other mental health topics. Chris, I'm going to hand it over to you as you dive into it.
Yeah, sure. Here we are discussing the whole question of law and policy in the context of suicide. And we've talked about this both at the level of the individual and the community. And I wanted to come to you, Jen, just to give us the UK perspective on this in terms of law and in terms of the policy approach.
So, yeah, suicide prevention, we have a national strategy that is then filtered down to local level for local authorities to then manage and sort of instill different approaches to raising suicide prevention awareness. It's very hit and miss across the UK. So there is some fantastic work going on up north in Scotland and sort of down south Devon area. In the middle, where we're based, it seems to be a bit hit and miss, and getting buy-in, getting people to really kind of acknowledge that suicide prevention is really key for young people. There are increasing rates with young people, sort of the 10 to 24 age range, and it's a really, really tricky landscape. You're either in an area where councils are buying into it, there's lots of good work going on, people are taking up the training, they're having the conversations, that they're open to the awareness raising, but it's not consistent across the whole of the UK.
Right. Yes, and that's particularly in relation to services provision, I presume. Is that right?
Yeah, it certainly feels that the third sector, so the BCSE sector, is kind of picking up a lot more, and we're moving far quicker than the kind of statutory services. And we're sort of plugging the gaps and making sure that help and support and that campaigning and that awareness raising and the changes to policy or pushing for changes to policy are happening, along with all the, amazing work that's going on with the researchers who, there's so much research going into this field at the moment, all different areas. And actually, I was at a conference last week, hearing just every single possible cohort you could imagine. There is there's an increase of the likelihood of suicidality. And my takeaway from that was essentially, okay, well then, if every single cohort is affected, then surely suicide prevention and those questions around suicidality just need to be out there and to be asked regularly. It's check-in, we are human. Suicidality will come to each and every one of us at some point. It's a natural emotion. Yeah, why are we not talking about it? And I guess just in the UK and possibly elsewhere as well, we're not very good at speaking about death, and we do just shy away and hide and cross the street if somebody's been bereaved. So it's a very tricky landscape in the UK.
Mm-hmm. And just as a matter of interest, the statutory requirement for someone dealing with mental health is at county council level. Is that right? Or at National Health Service level? Where
I think it's meant to be at the National Health Service level, I think. There's certain murmurings going on about that, but then you're finding, for example, Mind, who do safe havens, they're picking up the slack on that because obviously the landscape in the UK isn't great economically. But I think one of the key things for me, kind of maybe going a little bit away from law, another interesting research project that's going on that I had the privilege to hear is this 7-year research into livability, discovering livability. And what's really interesting about that is they're posing the question of, instead of suicide prevention crisis, what does it take to make a life more livable? And that is policy level. That is, all the environmental factors that contribute to somebody feeling suicidal, because it's not always just your mental health. You've got housing, you've got finances, you've got relationships, you've got communities, you've got employment, you've got, everything, schools, education systems, every single thing feeds into how somebody feels. And so actually what really, great that all of the third sector is stepping up and doing what we can, but actually we need change at a higher level that makes life more livable.
Okay, that's very helpful and interesting. Rosemary, I'd like to bring you in if you would, please. Can you give us a sense of the policy and law landscape in Kenya, please, around suicide?
Yeah, so Kenya has made important progress. Kenya, there's recognition of suicide prevention as a public health and systems issue. So we do have a national suicide prevention strategy. And as Jem has put it, it recognizes that suicide prevention is not just a health issue. It calls for a multi-sectoral approach. So it recognizes that prevention involves more than clinical services. It involves awareness, the stigma, eliminating stigma, strengthening community and primary healthcare, improving referral pathways. So it calls for a lot of national and county coordination. On the legal side, we've also had progress. The High Court of Kenya declared unconstitutional the penal code that criminalizes suicide. So it is now not a criminal offense for somebody to have attempted suicide. They do not go through the health and support system. So I believe what remains is really to close the gap between the good policy, good law with actual practice.
Okay, thank you. So we've heard from Jem, and we understand that there is, although of course suicide was decriminalized some time ago at the national level, the way in which suicide is dealt with within the UK does differ quite substantially from one part of the UK to the other. And what we've heard from the Kenyan side is that suicide is now decriminalized quite recently, and that's a fantastic step forward, obviously. I think, Christy, we ought to move on at this stage. And can I pass back to you for some reflections and take us through the final part of our program today?
Mm-hmm. Absolutely. And I think what's so interesting about having these two comparisons, I think, between Kenya and UK is it's also seeing some of the similarities between them, right? So the law obviously is in different places and along different pathways, different journeys, but there's still, it seems, this massive gap between, as Rosemary, you were saying, law and practice. And Jem, to your point, the law and also, beyond that practice, actually seeing good practice. What's that livability condition look like? And how do we really make the most movement possible around stigma, around suicide, around mental health, but also around, creating life opportunities that allow folks to feel that life is worth living. It's not just mental health. There's so many different components to it. So how do all these factors work together? It's multifaceted and it's complex. And that, I think, is a cross-cultural, cross-border thing that we're seeing, in many different contexts and many different spaces. So I'd like to come to you all just to kind of have a bit of final reflections, things that you would like to have shared, haven't had an opportunity to, or something potentially from today that made you think a little bit. OJ, let's start with you, if you don't mind, perhaps even coming at it a bit with kind of your individual lens and as a person who has had their own experiences, when you come across a young person that you might be worried about, or if someone does come across a young person they might be worried about, how do you stay with them? How do you listen to them? How do you, help them move forward with support? What's your approach, and what are kind of the first principles, if you will, that you would take?
I believe conversation change lives, and that is the entry point that I rally young people, especially with lived experience, to employ in their approach. And this is even borrowed from what we do, the concept of social contract that we do, where the principle is how can we bring conversation into the first level service of mental health service provision cycle. Can it be the first thing that I give you that opens up the situation? Because most of the time, again, it's not conclusive that any person who is experiencing or coming close to suicide is actually attached to a mental health condition. James said there could be other issues. Then how do we provide a situation whereby it is balancing whether it is a mental health challenge or it's just a normal conversation where a friend needed me to be there for them? So my approach is based on conversation, and then how do I find a situation or a place where I can be there to talk about what is there at the moment by first recognizing what they're going through, not my story, recognizing what they're going through and how they wish I would be there to offer them support that would lead to either their own solution, which might not require service, or either to a referral to a service that might go beyond just the conversation.
Thanks, OJ. And I think that brings us a little bit as well back to the start, which is it's all about these open, honest conversations and creating space for those in a judgment-free, stigma-free zone. And Jem, I know you've done a lot of work with that on Nay's House, and that's a very core part of the foundation of your work is around creating space for those conversations, creating open space for those discussions. What would it look like if there was meaningful investment into those types of things for young people? What does that look like in terms of not just the services you could provide, of course, but in prevention?
I think ultimately it just changes the entire landscape, doesn't it? At the moment, we've got a very disillusioned generation of young people who don't really feel like there is a future that they can buy into, and that there may even be a world that they can live in. That they are a very different group of young people to what we were when we were kids, affected much more differently. So I think for me, it's just about investing in them is the next generations, our future leaders, our future, politicians, our future actors, athletes, academics, whatever. In the UK, we ring fence money for looked after children, kids in care. But actually, why are we not just ring fencing money for young people, full stop? They are important and we need to educate them properly. They need to have an education system that works for them. They need to feel that, there is a future worth living and having. So I think it's not just a quick fix. It's not just the one answer. It is a massive holistic approach that requires investment on every single level.
Oh, if only these things could have quick fixes. There would be no point in having this conversation. We could just go do it. But I think, you're absolutely right. It's very holistic, and there's a lot of components, a lot of parts to it. Erla, I'm wondering if you can come in and just, from your experience a little bit, share a couple of reflections about, how you see some of these like holistic parts like working together. Have you seen some interesting kind of models or experiences where you think that there is that strong investment, you're supporting kids before they reach, a crisis point, and what does that look like?
I was sort of reflecting earlier, I was spending some time with my nephew this past weekend, and like toddlers do, they sort of walk into trouble, whether it's walking towards a flight of stairs or something, and automatically we, as adults or even older children, we catch them, we try to, make sure they're okay. And I think that's what we need to see a lot more when we talk about young people, suicide, mental health, early interventions. As we've all said before, it's not simple, and it requires a lot of people, stakeholders, to work together holistically. I've seen at community level great examples of of some of this taking place in terms of different stakeholders, working together. But of course, it's often there is so much that is needed in terms of investment, in terms of scaling up those interventions. Often young people don't have choice also. It's not just about having one solution offered to them. It's about, needing to listen to young people with lived experience. We've been listening to OJ today. That's, we really need them to be part of these sort of leadership conversations as well, in terms of shaping what support, works best for them. So there is, so much to do, and, a lot of these conversations to be had.
Absolutely. And from a kind of like a systems perspective, Rosemary, what would you say if you had to choose one or two things that need to be in place so that families and communities are not left to manage this alone? Is there, one particular takeaway or one thing that you would say is at the moment feeling the most important to you?
So I would say, from my observation in our work in schools implementing the Wellbeing Resilience Program, I see the importance of investing in young people's well-being and resilience, giving them the skills to deal with everyday situations. How do they cope with difficult emotions? How do they problem solve? How do they set goals? How do they deal with disappointment? And really giving them these skills for them to be able to thrive. However, I also feel that we do not shift all the responsibility to them. It does need to be a multi-sectoral responsibility and response. So they also need to have safe and protective relationships. They also need services that respond when needed. So I feel, yes, we must invest in their well-being and skills for well-being while they're in the education system and in their communities, as we also provide a safe and supportive environment.
Couldn't agree more. That's a fantastic way to kind of wrap up a little bit of what was, I think, just a conversation that touched the tip of the iceberg in many ways on suicidality across many countries. But hopefully it's given our listeners something interesting to think about, and potentially some new information as they move throughout their day. Chris, over to you.
Yeah, thank you very much, Christy. I mean, it's so strange in a way, because the solution is actually quite possible, or at least the solution in many cases is quite possible. Adults who are not afraid to ask questions, communities that do not respond with shame, services that are reachable, and policies that treat young people in crisis with dignity and support. I think in a way it's not too much to ask for a young person to ask to be treated with respect and dignity. And so in that sense, what we end up with is very much, I think, the whole question that our speakers have so eloquently brought out, the whole question of being able to master that very particular community approach, which is so important. I want to thank you, Erla. Thank you so much for being with us. And you, OJ, great to hear from you. Thank you so much, Rosemary. And thank you, Jem, very much indeed. We've had a genuine response from experiences in Iceland and China, Kenya, and of course the UK. And it's been a great privilege for both Christy and myself to be with you today. So thank you so much.